Hi guys, this is Andrea Christofferson. This is for Pharmacology Week 4. So I'm going to initially read the scenario first, and then I'm going to go over the questions that were asked of us to answer. So the scenario, emergency medical services team brings in a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in the nearby park by a jogger who called 911 from her cell phone after the woman screamed obscenities at her and then fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell stale body odor and urine. So our first critical question is, based on your first impression of this patient's actions and appearance, what do you suspect she is suffering from? So, with the initial impression of just seeing her, I would suspect as a nurse that she is having either a mental, she has either a mental disorder or a mental break that is currently happening, especially with the way she is acting and her appearance. Patient being disoriented, unstable on her feet, with unsteady balance, as well as being confused or having confused conversations with either not making sense or yelling out different things. Those automatically are going to be triggers for mental health. With, the professional, her asking for a bottle, that then in return would turn me on towards suspecting that she has either a substance abuse and is looking for alcohol of some sort, or a response for she's looking for a bottle could also mean maybe pills, maybe opioids. So those would be some of the top triggers I would be looking for initially with the patient's first coming in the impression. Second question, what short and long-term risks would you suspect this patient faces? So depending on whether there's short-term problems that are going on right now, that it's something that can be fixed with either medication or assessment, maybe detox, those would be all considered maybe short-term that would help out. So looking at her for short-term personal hygiene, also if she does need any sort of therapy or something in regards to that, her ability to access food. Does she have the ability to access food? Does she have the ability to a bathroom where she can do personal hygiene and cleanliness? Is she able to get in and out of a shower or a tub? What's her mobility? Those would all be short term for her. When it comes to long term, you're looking at more of like safety issues with long term. So I would be looking more on the lines of, does she have the ability to get around? Does she have a car or some sort of transportation? Does she have family or friends that can help her access food with grocery shopping for her, or picking up her medications? Also, long-term, I would be looking at urine as well as skin or any wounds. So it states in the scenario that she does have a wound or laceration to her face and to her arm. So I would be looking at, head trauma or something along those lines. When it comes to urine, if she has a urinary tract infection, you're determining that with labs and possibly a urine sample. So asking, does she have adequate access to water or juices? If she doesn't, then that could be a trigger for a possible UTI, and that could in return coincide with her mental status of her being disoriented and off of her confusion. Also with long-term, looking at does she have housing? Does she have a place to stay? The jogger found her in a park. Is she staying in the park? Is she sleeping there? So those things would be long-term, and that's something that a nurse as well as social services can help her out with if she does not have access to the things she needs for adequate health. Question number 3. Why do you think the patient's hands are shaking, and what do you think caused her confusion and combativeness? So this kind of goes back to what I just spoke about, short and long term. So you're asking those questions, doing an assessment, but you're also assessing the fact, does she need a mental consultation? Is she combative enough to where she needs to be restrained? Is this drug or alcohol related to where she may be coming down off of something, doing withdrawals? So is that something we need to keep in mind for not only withdrawal symptoms, but also cardiac issues and anxiety? So lots of lab work would need to be done. CBC, a blood sugar count, urine, liver, and renal functions all need to be done. A CT of her head. It says that she fell. Does she have a brain bleed? Could that be the reason for her confusion? As well as chest x-rays, just to rule out what she does have going on. When it comes to her hands shaking, they can all be signs of withdrawal. She has severe anxiety, and that has brought on the fact of her shaking and being very agitated. If she is not withdrawing, is it a possible brain bleed from the fall? That can cause shaking of the hands as well. So all of those would be factors that you would need to look at in regards to her being confused and combative with those symptoms. Number 4, what assessments do you think are needed for the patient? So again, any of the lab work would need to be gone over. Of course, a mental evaluation, a physical evaluation. Is she able to get up and walk around? Is she stable on her feet, or is her normal being unstable? Is that a normal for her? We don't know. Nobody came in with her, and we have no buddy there to give us a history. So we have to go based on what we're seeing and what we're physically looking at the time. Thanks, guys. That was for week 4 assignment with our live scenario.